Hi, I'm Dr Shirin Lakhani and I'm going to be speaking to you about one of our most popular treatments in clinic, the P-Shot or the Priapus Shot. The Priapus Shot involves taking platelet-rich plasma, also known as PRP, and injecting it into the penis to regenerate the tissue. PRP is essentially the platelets from your blood. So what we do is we take blood from a patient, spin it in our centrifuge, concentrate the platelets and then re-inject it into the penis to regenerate the tissues there. What the platelets actually do once they're injected is they release their growth factors, and that attracts stem cells to the area, causing the tissues to regenerate and rejuvenate. So you can get an improvement in sensitivity, you get an increase in the nerve tissues to the area, you get an increase in blood supply and thickening of the tissue. So with the P-Shot, we can treat conditions like erectile dysfunction, Peronies disease, which is a disease where you get a bend in the penis, which can cause a problem with function, and also a skin condition called Lichen Sclerosus. You can also get an improvement in the girth and the length of the penis with the treatment, but you would need to use a penis pump in conjunction to achieve that. Some of the questions I get asked about the P-Shot are things like, how do I choose my practitioner? So it's very important. The P-Shot is a particular way of injecting platelets into the penis. It was invented by Dr Charles Runnels, and all the practitioners that are licensed to perform the treatment are actually listed on the priapusshot.com website. So it is important for you to check that your practitioner is actually registered with the priapusshot.com website, which shows that they adhere to the protocols taught by Dr Runnels and they agree to use a decent quality medical grade centrifuge. The centrifuge that is used does make a difference to the treatment because it will have an impact on the quality of the PRP and therefore your results as well. So it's important that the practitioner who you go to is using a medical grade centrifuge, not just one that is used to separate blood in a laboratory. The machine we use in clinic is the Magellan True PRP, which is a top of the range dual spin medical grade centrifuge. So we know that the quality of the platelets we obtain is of the top grade. Other questions that tend to get commonly asked is, does it hurt? That's one of the most frequent questions I get asked. When we perform the P-Shot, I use topical numbing cream and an injectable anaesthetic. So the only slightly discomfort that the patient feels is in the injection of the local anaesthetic. Once that's worked, there is no pain whatsoever. So it's an incredibly comfortable treatment. Other questions, is it safe? Well, yes, PRP has been around for decades. It's using the patient's own blood. The only things we add to it are anticoagulants so that we can spin the blood in the centrifuge without it clotting, and calcium to trick the platelets into thinking there's been an injury so that they release their growth factors. The entire procedure from start to finish takes less than an hour. Most of that time is spinning the blood. The actual injections themselves take between 5 and 10 minutes. There's no downtime from the procedure. You can resume your normal activities straight away, which includes going to work and even having intercourse once the anaesthetic's worn off. There's very minimal side effects with the treatment. There may be some minor bruising, but other than that, the side effects are negligible. Now, I also tend to get asked how many treatments a patient needs. Now, this tends to vary according to the condition you're treating. So, for example, if you're treating erectile dysfunction, you may only need one treatment. If you're treating something like Peronies disease, then we tend to recommend 3 treatments. However, it does vary from person to person how many they need. And once you've got your result, we recommend maintenance every 12 to 18 months. Now, in terms of how long it takes to see results with the P-Shot, some people get an instant result, and this is down to the volume that's been injected on the day. The platelets actually start working at 3 weeks and they carry on working to get their full result at 3 months. So this tends to be the time when we discuss the results achieved and decide whether or not it would be worth having a second treatment. I don't recommend having treatments more frequently than this because you don't know the result you've achieved from the first treatment prior to this. So just in summary, the P-Shot is an effective, safe treatment. We have good success with it in clinic. We've had some fantastic case studies in the press. So if you would like to find out more or to book a consultation with me, please call or email the clinic. Thank you.